What's up, guys? It's Cyden, a medical student from Cebu Doctors University College of Medicine. Welcome to the series Premed Crash Course, where I will be interviewing friends of different pre-med courses and how they related it to their med student life. Hi everyone! So for today's video, I have a special guest with me, Miss Bea Cui.
Hello, hi guys.
Okay, so for today, I'm going to have an interview with her. I'm going to ask her a few questions about her pre-med course and how she can relate it or how she related it with medicine. So, Bea, introduce yourself, what pre-med course you have, and your school.
Hey guys, what's up? It's Bea, and I have a YouTube channel, Bea Cui. I am currently a second year, upcoming third year medical student from Cebu Doctors University. Me and Cyden are classmates, and my pre-med is physical therapy from Cebu Doctors University.
Oh, okay. So yes, as you have heard, guys, she has also her own YouTube channel. So go check it out. I will put a short pop-up picture over here in the middle. And then yeah, she really does great videos about CDU, her life, her travels. So next question, Bea, why do you choose your pre-med course?
So originally, the course that I wanted was psychology because I feel like it's my forte or something. But then my dad is actually a physical therapy graduate as well before he proceeded to med school. So he said I actually watched this movie. I forgot what movie it was, pero the girl that was there was Queen Latifah, and Queen Latifah there was a physical therapist. And that's when I got inspired because being a physical therapist, like being able to treat patients who are like into sports or basketball. So I think that was one of the things that made me want to pursue physical therapy. So that is why, and of course, aside from that, my dad was a PT student and he encouraged me as well to study PT. Also, my cousin was also a physical therapy student at that time. So he was fourth year, I guess, when I was a first year PT in the same school, CDU.
Oh, okay. So, you have a lot of influencers in your life, talaga. And then somehow along the way, of course, you were also inspired. And we have to thank that movie. I don't know what
Yeah,
movie.
I forgot the
I don't.
movie. I'll tell you the movie and then you can flash it there so people can be inspired as well.
Oh, sige, so that they can also check it out for aspiring PTs in the world. Okay, so when you chose PT as your course, did you think of it as like the course that you wanted to pursue a career in, or for the purpose of having it as pre-med course?
Of course I had set my mind to being a doctor since I think like your dad is a doctor as well, so like it runs in the family daw.
Yeah.
So it was quite in my plan, but also what they told me, that's why I took physical therapy at that time because PT right now, even right now, is in demand. And they have like a big salary in the States. So of course, when I enrolled to physical therapy, I was also thinking na, what if, example, in the next 5 years, I won't be able to pursue medicine? So at least I know that physical therapy is also one of the highest paying jobs in the United States or out of the country, unlike here. But yeah, if you have dreams of making it big outside, I feel like PT was one of the easiest or one of those professions that are in demand outside the country. So I was thinking about both, but I just wanted something to fall back. Like I had, yeah, like a second choice or something.
Yeah, so I think the same also with nursing since I also got
Yeah.
nursing. So I also thought that if somehow I had that small percent na I'm gonna stop medicine in like in second year, third year, or whatever year, I could go apply a job and then I could, have
Yeah,
a
especially
fallback.
now, nurses are in demand because of the COVID pandemic.
But yeah, medicine pa rin. Okay, so that's also a good insight to put into being a PT or having PT as your pre-med course, what can you say about the pros and cons? Let's divide it from first year compared to second year. So what are the pros and cons? Maybe you can name a few, like maybe three or five. So let's start with first year. So I know first year there are so many pros in PT, especially with the anatomy. So can you elaborate more on that?
So okay, for first year, if you're a student that wants to be a med student at Cebu Doctors University, as early if you come from physical therapy, we are actually we were introduced na to the concept of OBE, which is what we're doing now. Like we're doing reporting and stuff. Because
Mhm.
before we have TheraX, so that's therapeutic exercise. Usually, what we do is we make cases. It's like a case presentation still, but by group. And then we also have Revalida. So I think those are the things that are quite an advantage because in a Revalida, it's kind of like a case presentation, but then you have to say everything to the doctor or to the PASI as well. And you do Revalida on your fifth year 4 times. So you just pick a case, like it could be you have to study for like 10 cases for Revalida or more. And then you just pick one in
Pick a
random.
case.
And once you read that case, you have to write everything down, like the pathophysiology, etiology, and then you also have to do treatment, assessment. So I think those are one of the things that that is helpful. Like so that's why when I was pushed into this new learning style, it did not really it did not really it did not really make made me like it afraid of
Affected.
what's to come, I guess. Yeah, affected. Kasi, okay, wait, sorry.
Go lang, go, go.
Yeah. Pero but before really, I at the beginning of it, I was scared. So one of the cons, I guess, is that we are so used to the spoon feeding lifestyle, diba? Na we
Mm,
go to school, we listen to
notes.
lectures, yes, we get notes, and then whatever we are going to study for is in the notes. And at the beginning, I thought I could not do it, even if I had the prior experience. But as I went along with it, you adapted to that style of learning, and I actually like it better now than before, because I feel like I can study better when I read on my own than actually sitting down and just like listening stuff. Like it helps, but then I feel like it's always better if you also study
Oh,
for yourself. Yeah. So I'll okay, let's go to like the more subjective pros and cons. So those are like
okay.
the general pros and cons. So
Okay,
for
okay.
the first year, of course, the pro, as you said, is anatomy and physiology,
Mm-hmm.
because we really have one subject for physiology. We even have another subject for neurophysiology. So that's different. And then we also have a subject for anatomy, just plain anatomy. Then we also have a subject for neuroanatomy. So here, diba, in our first year med, it was merged. So
Yeah.
basically, yeah, we were able to pick it up na lang since we had it at different semesters and different subjects. So those were really the pro. And of course, block three. Block three is all about the musculoskeletal system and the neuromuscular system. So it's really easy. It's quite like a review na lang instead of having to study it again. And for me, I think one of the cons, not really one of the cons, the most con that I have is that we never really used a microscope in yeah,
Yeah.
that's the difference between PT and medtech, because medtech you're more on the micro specimens, and then when you're a PT you're more on the gross
Mm-hmm.
specimen. So I didn't know how to use a microscope. I didn't know the different epithelium during first year. It was so hard. Actually, I hated going to the lab. Yeah, right? Like
Oh.
I didn't know like what was the difference between the lining and the whatnot. That was really hard for me. And of course, that was one of the cons for being a physical therapy student and then having to have that subject. And of course, those blocks that focus on like the blood. So example that the block two,
Uh-huh.
right? Or like the
And
the
block four,
interleukin and the blood and whatnot. Yeah, and block
immuno.
four. yeah, so I didn't really know much about it. But for the rest of the systems, I was able to pick some of it up because it was anatomy and then it was physiology. So that was first year, right? So
Okay,
for
yeah,
second
first
year, I
year.
also wrote here what are my pros. So for
And
second year as a PT student, I guess my pro would be the pathophysiology still because um, I think this is where the med techs, which is the majority of us, and the
yes.
PT kind of meet in the middle. Because
Mm-hmm.
in PT, we are also big in pathology. Although the pathology for us is more on the gross aspect, the pathology for medtech is more on the micro, right?
Mm-hmm.
So like the cells and whatnot. So kami, we are given something like a gross specimen, and then that's when we know, oh, okay, that could be gangrene or something. So pathophysiology also is one of the things that I really loved during second year because I know nga if you memorize the normal physiology, you would know the pathophysiology of something because the pathophysiology is basically something na what if something went wrong during the
Mm-hmm.
process. So you can trace it like as well. That's why I like physiology in general.
Yeah.
Then the next one of course is block 3 is also a review of the different diseases. So there are some diseases right now that it's not new to me. So example for the genetics, we had actually now if you enroll in physical therapy now, they actually have a separate subjects for genetics because
Wow,
usually
okay.
yeah, because genetics as a physical therapist, diba, it's more on the children, children who are not able to walk, who have deformities. So of course they are referred to the rehabilitation science. So now I'm actually amazed at them since they have their what they call this genetics. Another one I think that is a pro if you are also a physical therapy student now. One of the pros for you is that you already have imaging. So us when during our time we didn't have an imaging. It will just come out of the exam, and I still don't know about imaging. Even now, as a second year med student, I think the only thing that I can memorize in imaging is maybe like some of the X-rays, some of
Uh-huh.
like the MRI, CT scan thing, but nothing really. So if you are a PT coming from CDU, you'll probably have tackled imaging already. So you are very familiar with MRIs and CT scans and whatnot. So that is such a pro. And then the other pro that I will say is the drugs because we have pharmacology as well in
Mm,
PT. I think you also have pharmacology in nursing.
yeah.
So, our pharmacology lang though is focused more on the neuro drugs, cardio drugs, and the muscular, neuromuscular drugs or like joint drugs like NSAIDs and whatnot. So a lot of those I've read before. I think for diabetics as well, we tackle that because we have patients who are diabetic, who are
Mm.
hypertensive, because they are the ones that suffer from nerve injury or any part like that. So we have a lot of patients about that. And we read the charts. During internship, we also read the charts. So just like nurses, we read the chart and then we write on the chart and then we
Good.
also read doctor's orders. So that's where we are similar also in nursing. So when we know what medicine, example, the patient is taking, example, we read that patient had high blood pressure and then he just took this med recently. We have the decision to defer the patient. So if you know the side effects of the medication right onset while you're reading the chart, you know that you cannot perform physical therapy because of course the
Mm.
patient will be
Oh yeah.
tired or the patient have low blood pressure. Yeah. So that is why it is also important um what do you call these for PTs. And then for the another pro, okay, this is my fifth. I know. Actually, for another pro, pala, I just remembered. I did not write this down, but PBR for me is a pro
Oh yeah,
because
yeah.
a lot of the procedures that we did during PTR, we actually tackled already in PT. So I think the only ones that are new to me are the breast because of course we did not have breast exam during PT, but a lot of the tests that we did, like the rub sinks,
Mm-hmm.
the eye as well, we did
The
not do the
eye.
eye. The eye and the ENT, I would say we did not do, but some lang of the cardio, some of the respite, some of the we have discussed it because we have physical therapy assessment, and that is part as well of our PE. So I would say siguro the physical examination for PT and for medicine is quite similar because in a way you are assessing man the whole body, diba? The gross body. So a lot of
There's
those
no
are similar.
histo, yes.
there's
Walang
yeah, there's no
histo.
yeah, but the cons though, I
Yeah,
wrote here the
yeah,
cons of
yeah.
PT
Okay,
is
sige, go.
is parasitology.
Mm, true,
No,
true.
remember block 5? Like it was all eggs, and then I was like,
I
I
think,
was like,
was it block 1, yung first dose of
oh
Tricurus,
yeah,
Tricura?
like the teeth and whatnot. I was like, what? There are different worms.
Mm-hmm, mm-hmm.
Didn't even know that. And of course, microbio as well. Like I didn't
Oo.
know the difference between gram positive and gram
And gram
negative.
negative.
Right?
Even
Or like
now,
acid test.
yeah, we had it block 1, and then when we had our exams for block 6, I even like search it again, like what's the difference again between gram positive and gram negative. Like it wouldn't stick.
Yeah, same. Like I'm not even an expert of it. Even if I just finished the sem, I'm still
Mm-hmm.
like, what the? And of course, the last one is pharma.
Pharma.
Pharma, because a lot of drugs that we discussed this sem, despite having example the cardio drugs and whatnot, there
Mm-hmm.
are also a lot of antibiotics that was discussed. And then I think antibiotics we did not tackle it in PT before. So there are a lot of drugs to be memorized, that's for sure. And that is a con if you are coming from physical therapy. But at least, diba, you have some pros. So since you don't have to study as hard for the pros, yeah,
Mm-hmm.
you can study for the cons. So I think those were my pros and cons for first year and second year. Ang gulo, no? Sorry.
I can really relate, especially sa cons for your part, because I think us na like non-medtechs, no discrimination with the medtechs guys ha, but basta all the non-medtechs, all the medtechs subjects, I hate them all.
Yeah.
I'm sorry.
When you see it on paper, you're just like, what
Sometimes
the
when there's a quiz like, okay, pang medtech, okay, pang medtech, pang medtech. I
yeah,
like
you have to mentally prepare yourself na lang for the 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 bloodbath that is
that.
medtech subject.
Okay. So, okay, I have this last question, or if there are any questions you'd like to add or to answer, who would you recommend your course as pre-med? And or like what type of students do you think who are fit to pursue your pre-med course as
Okay, so
a pre-med?
yeah, thank you for your question. Wow, this universe. Pero, no, of course, who would pick if you really want to be a doctor, diba? Why would
Mm,
you pick physical therapy? Because 5 years na siya. It is. Oh no, now it is 4 years pala. It's the same
4
for
years?
everyone. Yeah, it's the same for
Ah,
everyone na. So I would say if you if you like walang graveyard shift, number one. There isn't a graveyard shift for physical therapy. We just work 8 to 5. That is just the working hours for physical therapy. There is no emergency in the rehab because, of course, we are a tertiary kind of care na, tertiary care. So there's no emergency. And then if you are curious about how the human body functions, how the nerves function, I
mhm.
think one of the most interesting subjects that I like until now is neuro. So if you want to learn more about neurology, if you want to pursue neuro or orthopedic surgery or even general surgery in the future, I think physical therapy is a good foundation for you to be able to memorize all of the anatomy, all of the physiology of such things. So yeah, if you want to pursue physical therapy, don't be afraid to pursue it. I know we are not appreciated here. A lot of medical professions are not appreciated in the Philippines. But like I said at the intro, nurses like Cyden and physical therapists like me, we are in demand outside of the
Outside.
country, and they pay well. They pay well. So if you also want that and do not want to proceed to med school, that is also a good option to consider. So
Okay. So, mga aspiring neurosurgeons dyan or anyone in the surgery field, ikaw, I'm gonna ask you this question. Did you ever think of neurosurgery as your specialty or anything? Or what's your specialty in mind for now?
okay, before I used to want to do oncology, so that's cancer.
Oh,
But
okay.
then as I progressed to med school, so far I really find yes, neurosurgery or neurology very interesting because I kind of know it by heart than the rest of the subject. So it's still really interesting to me until now. So yes, neuro.
Wow, okay. Actually, I also want
How
to be
sad?
here.
Do you also
Oh,
yeah, you should watch hospital playlist because the girl there is a
oh,
neurosurgeon. Diba?
okay. So, any last words, Bay, you want to share with others, your plugs or anything? Go.
Yeah, hey, don't forget to follow me also as well on my YouTube channel, Bea Cui, and of course subscribe to Cyden's channel. She does a lot of tips as well about med school, and yeah, you should pursue medicine. Don't be afraid to pursue medicine because I know there are times that we feel lost and we feel like it is not for us, but eventually, like I know it will fall into place, and you just have to take the first step. Wow. But yes, see you all, future doctors.
Yes. And future PT or future doctor. So, thank you, Bea, for this
Thank you for
opportunity.
having me.
Of course, guys, go check her out. And if you want more videos, oh, I think this will be the first video that I will
Yes, more
um
to come though. Yeah.
showcase with pre-med course blank with blank. So you are the first one, Bea. Thank you so much.
Thank
And
you.
woohoo, give it a round of applause. Bye, guys. So see you on my pre-med course series. I'm gonna feature other pre-med courses, and don't forget to click like and subscribe, and also with Bea's over here. See you guys. Bye.